Hi everyone, I'm Georgie Pipkin. We're in the Baptist Health Newsroom. Thank you for joining us today. Hot topic this week, back to school. We're here to talk to our experts about tips, questions you might have. Feel free throughout the segment today to type in any questions. We'll answer as many as we can. Even if we wrap up towards the end, we'll write and scribe to you and message you and let you know all the answers to your questions. So with us today, we're going to go ahead and get started. We have Dr. Fernando Mendoza. He's with our Baptist Children's Hospital Emergency Room. We're happy to have him for some insight today. And Dr. Danielle Squires, who's with Kings Bay Pediatrics. Thank you guys for being here today. We're happy to have you and happy to have a good discussion here about back to school. Let's jump right in. Over the summer, parents are stressing about getting their immunization forms for school and vaccines. Dr. Squires, talk to us a little bit about what they should already have prepared, or talk to what vaccine should they have.
Absolutely. So most children should already have had their vaccines completed and all their health forms filled out by their pediatrician already. But if you haven't yet as a parent, or in anticipation of next year, absolutely schedule your well child check for the year, your annual visit, at least over the summer before school starts, in order to enter school. So pre-K and kindergarten, and then again for 7th grade, the health forms do need to be updated with the relevant vaccines. And, as you know, we're having resurgence of several illnesses that we hadn't seen in many years, measles in particular.
Right, we've talked about that a lot, even with Dr. Mendoza, we're seeing that, so parents are kind of like on edge.
Everybody's a little worried about it.
Yeah.
Pertussis is another, the whooping cough. So everybody needs to make sure they see their pediatrician, that the kids are up to date on their vaccines. There are vaccines, certainly in the early years, from birth to about 4 or 5. There's a whole load of them. That's really when they build up their immune systems. And again, before that 7th grade visit, tetanus and meningitis become very important, so they get booster shots for that. So those are really important visits. But every year, of course, we want to see those kids in our office for an annual exam.
So talk to us, Dr. Mendoza, too, about, people go back to school and like the sicknesses hit the household. So you get the flu and all these things are coming out of the woodwork. So what are some tips for parents, or what are we seeing now in Miami-Dade?
Just to build on what Dr. Squires said in the vaccines, one of the first questions that we'll ask parents is, are your immunizations up to date? And we'll actually go into details, like especially the younger kids, because vaccines are designed by the CDC and kind of the Department of Health. Those are kind of all scheduled based on when the kids are most vulnerable for illnesses. So it's a real different situation in the ER when we walk into the room and little Johnny has 103.5 fever and he's 18 months old and says, well, do you have your vaccines? Well, yeah, kind of, sort of. Let me see the vaccine record, let me talk. Now we have a link, we're working on a link at Baptist Children's Pediatric ER where the system will link to the Florida Department of Health so we can see what vaccines they've had.
Perfect.
But fully vaccinated is a different animal than not vaccinated, partially vaccinated, or even alternative vaccination schedules. Now, we respect parents who make those decisions, but really, it kind of drives everything we do in the pediatric ER, especially with infectious diseases, with fevers, which is one of the most common things we see. I know Dr. Squires see a lot of fevers, get a lot of phone calls for fevers in her office, in her practice. So we will see an increase or an uptick in infectious disease or communicable diseases this time of year. So everyone's off on, at the beach or on vacations with their family somewhere on a road trip. They all come together at school, and 30, 40 kids in a classroom, and they're all sharing toys and snot and saliva. And you can put as many wipes and Purells out there, but at the end of the day, we'll see that stuff come through the ER with the high fevers and the situations where maybe the pediatrician's offices may be closed and parents are worried. We'll see them in the ER, and the first thing we'll ask about is vaccines. Now, once they're there, we'll take good care of them, we'll figure out what's going on, but we will see an uptick. We tend to see a little bit of a decline in visits in the late summer, like right before school, because everyone's still on vacation, and we'll see next week things get a little bit busier in the ER.
I know my little one started this week, and kind of a big talk at home was wash the hands properly, because he's little, he puts his hand, he doesn't even get soap on it. So some tips for parents, maybe make sure that you've educated your kids. They're going back into that classroom. Wash your hands.
Exactly. So parents always ask, how can I keep my child healthy? What can I give them? Is there some vitamin I can give? And I wish I had one. But we know it all comes down to hand washing. That's the number 1, 2, and 3 is wash your hands before you eat. Wash your hands when you get somewhere, before you leave somewhere. Really start to drill it into them early so it becomes the routine.
Perfect.
my 4-year-old's in preschool, and constantly we're washing. Wherever we go, we wash our hands when we get there. So that's really number one. The other thing is really start to cultivate with your children a good routine. So making sure that they go to bed at an appropriate time so they're getting enough sleep. When we're tired, we get run down, and we're more likely to get sick. The other thing, which I think is important to talk about amongst us, is making sure that if your child is sick, they stay home from school.
Right.
Because when a child comes into the classroom sick, and especially with the little ones and everybody's touching everything, we all get sick.
Great tips. Talk to us a little bit, Dr. Mendoza, about sports. So kids are going back to their sports, their soccer and their whatever routine that they're normally in. It's still hot in Miami, so heat exhaustion. You're seeing that come into the ER. What can people do? Hydrate. What else are you seeing?
Right. So we know that sports start now, and some of these sports in high school or in grade school have started. They've been going on in the summertime, really, but it really starts to get a little more intense now with football, soccer. I think the fall sports are starting to happen now, and it's really hot. August, September are some of the hottest months we have in Miami. In South Florida. So when you're hydrating, when you're out there, we kind of heard the old adage, if you're thirsty, it's too late. It's true. So the night before, or that week, really keep it with the hydration, with the water. And really, water kind of is the best thing. We don't need a lot of extra juices, a lot of extra Gatorade. Look, if you're a long distance runner or you've been doing sports, an event for a couple hours, then get some Gatorade, some Powerade, some sugar-based, kind of some carbohydrates in you. But before, water is really the most important and really the easiest and the safest thing to drink. Now, once you get to the point, if you notice your child is coming off the field, then the first signs you'll see are, number one, you'll see really flushed, okay? You'll see some redness, headaches, fatigue. Those are things that you right away get them off the field, get them into a cool place. Even in a soccer field or in a field and you're not anywhere near air conditioning, get them into a car, turn your AC on, get them wet. Take something from the cooler, wet them down. And obviously, if you start having any kid who has a real hallucinations, headaches that are really bad, vomiting,
come see you guys.
I would press that 911 button or get to the ER, a pediatric ER right away. But really call 911 because then you're talking from heat exhaustion to heat stroke. At that point, you'll see the temperature shoot up, where the body can't control the temperature. That gets really dangerous because you start to get in a kind of risk for seizures and breaking down other things in the body. But be really, really cognizant that this time of year, really intense kids want to do really well, especially the high school students. Now, high schoolers are off, and you have no control over them, right? So I have a couple of high schoolers, and they're doing their thing. So you drop them off in the morning, they come back at 7 in the afternoon. You got to really be on them, and you got to be that parent who's really putting the water bottles, kind of in their hands before they leave. Make sure they're packing that, texting them, reminding them because they're on their phones. Hey, make sure you drink. Make sure you drink.
Take a sip. You're going to your next class. You have a break. Take some water.
So eating, and remember, a lot of what we do, a lot of the way we get our fluids is through solid food. So a lot of our foods that we eat are providing that hydration. So you don't want to get the kids to skip between. They eat lunch. Some of these schools are eating lunch at 10:30 in the morning.
Right. It's
early.
Yeah.
So make sure they get something right after school before they go do their sport.
Great. That's great advice. I think a lot of parents, as they start to prepare, they get into the routine, make sure you're at bed at a decent time, wash those hands, get the water. There's a lot of things to check off, but once you kind of start from the beginning, establishing those habits, I think it's helpful.
Yes, exactly. So. And to lend to that point, starting early, so even when they're on little in elementary school, encouraging them to drink water, encouraging them to make good choices with the foods that they're going to eat. And when you're home with them and it's a weekend, making sure that you kind of guide them. Okay, let's include a fruit, let's include a vegetable.
Right.
Let's try to kind of build on those habits when we're all together as a family and when you're little, so that they take it with them and they go to high school and they start to do the right things for their bodies.
Great advice. So I know we're going to talk to Dr. Rohaidy in a little bit, so stick with us, but we want to talk, we've talked a lot about physical. So anxiety, stress, that's also a big hot topic, the mental aspect of it. Let's touch on it a little bit. What are some tips maybe for parents? Is it, just stay at home with their child, they're a little bit stressed, they have a big test, and when does that convert to like, okay, I think we should probably see an expert or come see somebody when it's more serious? Have you seen that in kind of your practice or even in the ER?
Sure. So, part of the reason we emphasize come for your well child visit isn't just the vaccines. It's also to assess how is your child doing overall. What's their sense of well-being overall. So a lot of what I look at is, are they sleeping well? Are they engaged in activities? How's their schoolwork? Because a lot of kids will have anxiety about how they're doing at school. or maybe they're having trouble learning, or having issues in school that haven't been picked up yet that maybe they need extra support. So a lot of what we do in our office is we'll kind of try to assess and evaluate that. So that's kind of the first element there. And then when I look at a child where I'm concerned that they're anxious or they're depressed or something else is going on, I want to look at, overall, are they participating like they would? Because sometimes parents don't recognize that, your child's suddenly losing interest in their sports activities or their friends, or those sometimes are indications that something else is going on. And I think, we both see a lot of the physical side of stress and anxiety, where kids come in with belly aches or headaches.
And then they're like, I don't want to go to school, because my
exactly.
stomach hurts, and it leads to other things.
So GI complaints, gastrointestinal, belly aches is one of the most common presenting signs or symptoms, especially for young children who can't verbalize, hey mom, dad, I'm stressed about this situation. The teacher stressing me out, or the amount of work I get is stressing out, or just even the social environment. Sometimes making friends and having a friend, and that friend, has some kind of turns on you or whatever happens in the kids' world. We've all been there, that can really kind of be manifested. Another thing I want to point out, what Dr. Squires and her practice does is a lot of screening. We see a lot of the end kind of result, a lot of anxiety. Sometimes we'll see drug use manifesting as anxiety, coping skills. But a lot of the high schools will do pre-sports physicals and offer them en masse, and that's fine for those who don't have access or have limited access. But even then, I would really encourage those patients to go to the pediatrician for that sports physical, because that's the one time that you may get to see a 14 or 15-year-old that year that really gets them into that door. Says, now I can do your sports physical. You're fine. Your arms and legs work, and your heart's fine, and we'll do that. But let's talk about what else is going on. So and then you have body image body image disorders, and Dr. Squires and her team or her practice can look at that. Are there eating disorders that are going on, especially in the female athletes, but male athletes too. In the ER, we will see anxiety kind of related issues right before exams, during the kind of heavy type of exams, even midterms. We'll see drug use, and that's something. If you're seeing a change in your child's behavior, in the way their grades are, we can do that testing in the ER when it's relevant. If someone's kind of has a mental a status change or is acting, but we don't do drug screenings just for, parents sometimes will come in and say, well, I just want my kid to screen for drugs. Well, it's just not relevant to the ER visit, but if that's something you kind of want to really get ahead of if you can.
Great. This is great information. We're going to continue the conversation, but any final thoughts or last kind of tips for parents that we should know about before we kind of segue a little more into mental health?
From an ER perspective,
top 3 things we want to know.
We want to encourage sports in kids when they're back in school. So even though they may have some cuts and bruises and sprains and strains, we'll see them in ER, but we don't want to discourage any of that. Making sure that I think vaccinations on our end of the ER is one of the most important things for kids with fever that we'll see. That's really important to keep them healthy, and actually we have to do less things to them or to figure out what's going on. The third one.
All right,
Dr. Squires. Hand washing for sure.
Hand washing,
that's my takeaway.
At 1, 2, and 3, hand washing, and then just start to build the routines now. Because we want to empower our kids as young children and teenagers to go off and take ownership of their bodies, ownership of their health. So the more we can instill in them healthy habits now while they're young and in our homes, the better they're going to do when they go forward as young adults.
Great. A couple of the reminders for parents that are watching and folks that are joining us today. We have a Care on Demand app. You put it on your phone now, download it. We are offering an urgent care visit for free for anybody who needs it. Minor things like pink eye, things that you might not want to have to end up in something more serious. If you plug in the code BACKTOSCHOOL, we'll get you 1 free visit. If it is something more serious, go ahead and visit Dr. Squires in the Kings Bay Pediatrics. It's a great practice that takes care of your kids. And if it's a little bit more serious than that, then obviously we'll see Dr. Mendoza in the Baptist Children's Emergency Center. So thank you guys. We're going to take a quick short break and we will be back with more. Thank you guys. Hi guys, welcome back. We're here at the Baptist Health Newsroom. We're still talking about back to school tips. So joining us now, we have Dr. Rachel Rohaidy. We're so happy to have you here. She's with us, one of our psychiatrists here at Baptist Health. And we also have Danielle with us, Dr. Squires, joining in for the discussion. So we talked a lot about the routines, getting back into the habit of healthy, sleeping, eating, nutrition, all of that. Dr. Rohaidy, talk to us a little bit about some of those signs of recognizing some of that anxiety or stress, and at what point should that parent be a little bit more worried to go see an expert?
Absolutely. So I think what the other physicians had said is absolutely right. What we need is good, healthy eating, nutrition, hydration, water, and sleep. It's really important for mental health. We want to talk about sleep hygiene, which is really important. So really comfortable room, electronics out of the room, no reading in bed, no phone in bed. Everything should be done in the proper place. And bed should really be for sleep.
For sleeping.
To get that nice 8-hour sleep, whatever it is that we need, so that we can regenerate
and the body and
exactly.
feel ready to go the next day.
Exactly. And so signs and symptoms that you can see that that there's something different there is, one thing you really want to look at, especially for younger children, is irritability. So, any change in their norm, right? So irritability, easily frustrated, having more tantrums perhaps than what was normal. Exactly. And a lot of the somatic symptoms, a lot of GI symptoms, a lot of headaches, this hurts, that hurts. Mm-hmm. And so I think that if you see those sorts of things, you need to have a conversation and take a closer look as to what's happening.
Okay, that's good advice, because I think sometimes parents don't know, like, is this serious enough? Are they faking the tummy ache because they don't want to go to school? Or is it something more serious? So I think it's hard to tell, and I think that's good advice for parents to make the this distinction. Where do I go and what should I do and when?
I'm really big on conversation, talking to your children, really, having that dinner at night with the family and talking, no electronics, and finding out what's actually going on.
How was your day? What did you do today? Because I know I have 2 boys and they don't talk, so it's like pulling teeth. Like, what did you do? Oh, nothing. I'm like, really, nothing. So I think that's great. Having those discussions are helpful. Other things that what we see a lot, bullying, in all ages, really. Any warning signs that we should be aware of, or things that we should maybe be telling our kids, either not to be the bully, or if you are being bullied, maybe it's a time to have a conversation with a teacher or a parent. So talk to us about that a little bit.
So I think what was mentioned before is right on, getting your child involved in sports and clubs and having good relationships. And so I think that is really key. Open communication, talking to the teachers, talking to their coaches, and really being involved with your child, not letting them kind of out to their own devices and maybe making friends that perhaps aren't so healthy for them, really knowing who their friends are, getting to know the parents of those friends, just being as involved as you can. I mean, remember, we're in a society where our children have access to so much information, right? Whether that's healthy or not healthy. And so, not only does, little Johnny knock on the door, can Timmy come out and play, but, Johnny's got access to your child via Facebook, via telephone, via computer, via whatever device, playing video games. That other person in the outside has access to your child. And not every access is good access. Right. So you really need to be involved. If your child is playing a video game, what video game are they playing?
Play it with them.
Exactly. Play it with them.
That's a great tip.
What show are they watching on TV? Watch it with them. Really remember that you have a child and your child has a life outside of the home. And just like you guide your child in the house, you need to guide your child when they're outside of the home as well.
And Dr. Squires, you mostly see the physical aspects, but are there ever times where you may ask, have you been bullied at school? At what point maybe would you tell the parent, I recommend maybe you go see somebody?
I try to talk about it at every visit.
Okay.
Who are your friends? Starting with little, even 3-4 years old. Who are your friends? And sometimes I'll even ask the parents as the kids get over, what do you think of his friends? Because sometimes the parents say, I don't know them, and that kind of maybe, will encourage parents to start to get to know their child's friends, have them over,
play
meet at a park,
and,
do something where they can kind of engage. So, part of that's important. And what I like to do is at every visit I talk about, do you feel comfortable at school? Do you like your school? Do you feel safe at school? And home, and I try to gauge that. And as the kids get older, I really like to speak to them, one-on-one, because sometimes children will, divulge something with me that maybe they wouldn't with their parent present. And sometimes we're able to pinpoint, somebody who came in maybe several times for a stomach ache that we couldn't get to the bottom of a physical reason why they're having those stomach aches. But maybe, when the parent's out and we're talking about school, we find out, that somebody's been bullying that child, and how can we work on it? And usually everybody leaves feeling a little bit more relieved because we come up with a plan.
Right.
Let's involve the school, let's involve the parent, whatever we need to do to
I think
make
that's
it
why
easier.
it's so important to have that visit and those conversations even
Mm-hmm.
at the pediatrician's office. So that's so helpful. Dr. Rohaidy, we also talked a little bit about sleep and screen time and routines. Any other kind of red flags or warnings that you can kind of tips for parents that maybe they would never think like, oh, I should have seen that, or I should have caught that, or
Yeah, absolutely. So, you want to look for changes in behavior. So, extreme fearfulness all of a sudden, crying spells, isolation, changing in appearance from one thing to the next. I'm not talking about dyeing our hair. We all go through these phases where we're trying to find who we really are. But we're talking about like drastic changes, not showering, not brushing your teeth, things like simple things like that. Really know and when you have a routine, which I love, the advice of having a routine with your child, and all of a sudden your child's out of routine, something isn't working. I think those are red flags.
Red flags. Mm-hmm. It's time to have a conversation or take a look a little
absolutely.
deeper. Mm-hmm. Anything with kind of ages? Is there anything that's maybe more for the younger kids versus the older kids? I think the older kids are the ones that are maybe more on social media or their phones or whatnot.
Right.
Any differentiation between the ages that we should kind of look
I
at?
think that just the ability to verbalize, this is what's bothering me, I think that's really the difference. But all kids go through anxiety, all kids go through difficult times. It's just, is that difficult time impeding your child from going to school? Is that difficult time impeding your child from even attending a family dinner? So being able to read those signs is important, because not all the time is your child going to be able to verbalize how they're feeling.
And what about just normal stress and anxiety for every day that they really don't need to go see an expert? So I know homework, I know that everyone's stressing about homework. And so what are maybe some things that could put your child at ease that you can just do at home without having to seek, more serious medical care, that they're just stressed, they have a big test tomorrow, and maybe it's, I don't know, I'm making this up, taking them out for ice cream, like what helps, that parent to say, okay, let's go do something fun, you have this big test, maybe it's after an incentive. What are things that maybe you tell your parents and your patients?
I think anything that you can use to help your kid works. So whether that be your child loves doing this particular thing as a hobby, use that. Say, well, take a couple of minutes and have some fun and then get back to it. And, if they're easily frustrated because they're not getting a certain topic, get help with that particular topic quickly. Try to stay ahead of school, because things can become quite overwhelming. Once they have a bad grade in something and they've seen that they can't excel, well, then the next test is just going to be worse because they've already failed one test. So, try to stay abreast of things and try to keep things easy. Anyone who pushes either themselves or their child to study 12 hours a day, that's a little, that's a little much.
It's much.
So, study in short segments, take breaks, eat, be healthy while you're studying.
We hear a lot about buzzwords, mental health, therapy. And I think if you're, 15, 16 years old and your parent is as concerned and you're like, let's go see, seek help, let's go mental health therapy counselor, they're like, no, I don't want to go. So what are some other words that maybe a parent can use to kind of encourage them if they're worried to go maybe seek some help?
It's a little tough,
It's
because
hard,
I think that's different for everyone. But the cool thing is that since you mentioned the care on demand, we're in an age of technology. And we are sometimes quite busy as parents, and we don't have the time, to sit in traffic and go to an appointment. So you can have mental health therapy sometimes right there on the app. And you can engage your child and say, let's scroll through these 5 or 6 therapists, and who do you think that you would like? And, have them help pick out who they would see.
It might be a little easier, the comfort of their own home or a special area that they like, and it's just on their phone. I know right now, if you're downloading the Care on Demand app for a wellness visit or a mental health to see somebody, we're offering $10 off. Just plug in the code WELLBEING and we'll get you that. But that's great advice, because that way they don't have to actually feel like they're driving to go somewhere, to go seek this help. So we're starting to get questions coming in our Facebook page, so we're going to answer as many as we can. And here's one that came in. Can it just be back to school jitters? How long into the school year should you be concerned? So I know first week, people are getting back into the routine. There might be some hesitations here and there. We're getting into, the first month, let's say. But after that, when should people be concerned?
I would expect, maybe first few weeks, and then most children should fall into a routine. Most, especially the little ones, typically can fall into a routine after 2-3 weeks. Older children sometimes take longer. But to your point, if a month or two has gone by in school and we're not seeing that the child is really fallen into sync, then that may be a time to bring in a little extra support. What you're saying with how do you tell your child that they need extra help, I phrase it that way. When we are sitting down with a family and we're saying, I think we need to see a psychologist or a psychiatrist, we say, we want you to have as much support, and we want to make sure that you have all the tools you need, the skills to deal with the stress, the test, the homework, the kids that might not be nice. So we try to frame it that way. Just like if you needed a math tutor, it's really the same thing.
That's great. Great advice. A couple of more questions are coming in, so feel free to keep chatting on there. So if my kid shuts me out, and is it okay to have a sibling or relative talk to them? Oh, great question. Yeah, because sometimes, you get that mom or dad and they throw the door in your face and I don't want to talk. But maybe there is an aunt that's like the cool aunt, or is that okay to kind of have that family member come in and help?
Absolutely. I think it takes a village to raise children.
It really does.
Any help that you can get from siblings, older siblings, cousins, whoever the child trusts, absolutely.
Great question. We have a few minutes remaining, so we'll take maybe one or two more questions if they're coming in. If not, any final thoughts that you guys have? We're excited to kind of get back to school. Miami-Dade County is ready. Everyone's in their traffic patterns and their lanes, and we're excited to have you guys give us some tips. So any last reminders for anybody watching?
Well, absolutely. So, I want to remind parents that you are the example for your children. And so we really want to be careful with how we relieve stress. And a lot of times we reach for the glass of wine, or we reach for the cigarette, or whatever the case may be, and we're reaching for that a little too much. And just remember that your kid is watching, your kids are watching. And so if they see that, when mom is stressed and she has a little bit of wine, I'm going to do the same thing. And so, just try to be an example for your kids.
Great point.
Absolutely.
Yeah, the parents get stressed too with all the checklists and to-dos.
Absolutely. I'm going to jump off of that because what we want our kids to exercise. We want them to go to bed at an appropriate time. We want them to get off their phones before they go to bed, and you have to model it. Otherwise, if you're not exercising your child, why should they? So it's really, you're choosing the bag of chips over, the healthy snacks.
Right. Yeah.
Then that's the culture in your home. So it's really, your parents absolutely set the tone.
Yeah.
Great point. So Dr. Squires, Dr. Rohaidy, and of course Dr. Mendoza, thank you guys for being here today. Great discussion. If we have these busy parents that are on the go, you can also listen to this kind of like a podcast. If you just plug it into your car and kind of hear all the advice that was given today. Again, Care on Demand, it's a great app. If you need it for urgent care or even for mental health, it's there in your back pocket when you need it. Thank you guys. We'll be back soon and with another Facebook Live. Take care.